Hello for all the people that are seeing us. It's my pleasure. My name is Romulo Batista. I'm a forest senior campaigner, and we will start our round table here to speak about the climate crisis and the health crisis in Brazil, focus on indigenous people. Together with me, we have Dr. Ana Lúcia. She's a doctor with a PhD on public health research at the Oswaldo Cruz Foundation, and she's the coordinator of indigenous health on the Abrasco. Together with me too is Dr. Antônio Flores. He's an infectious disease doctor from Medical Without Frontier. And he's the medical coordinator of the response to COVID-19 in the Amazonas state. In some minutes, will join us Cretan Kaigangi. Cretan is from the Mangueirinha indigenous land, an area of Atlantic forest in the countryside of Paraná that is continuously threatened by loggers. In April 2003, Cretan and his people, Kaigan, helped to create the Free Land Camp in Brasilia. Today, this camp is the largest forum of the Brazilian indigenous movement. He also initiated and led the indigenous battle against the fracking in Brazil, which enabled the extraction of oil, gas, and coal from the soil. I would like to start talking a little bit about the context in Brazil. And my focus will be obvious on environmental and the government. Last year, Jair Bolsonaro and his administration dedicated themselves to a project explicit and more than evident to dismantling the environmental control and inspections framework, attacking all environmental policies, excluding science and logic from the governmental decisions, and handing over natural resources to those who deforest and other environmental criminals. The year of 2019 was tragic for everyone in Brazil, from the beach to the deep forest, and filled with impotence and violence against traditional people. Deforestation burned down the Amazon, that jeopardizes global efforts against climate change, and the genocide of indigenous people have outraged the entire world and threatened the Brazilian economy with sanctions. But nothing so disastrous that can't it get worse. In 2020, the situation further deteriorated. In the year which the Minister of Environment was caught on video saying that we would take advantage of the pandemic to regulate and sneak and the bullcrap, Brazil is on track to break a new record in deforestation. The indigenous peoples of the forest are asking the international community for help. The socio-environmental agenda in Brazil is in its worst moment. I think this can give an idea what we are passing here with this government. I will open for Dr. Ana Lúcia to speak more on indigenous health. Dr. Ana.
Hi, Romulo. Good morning, everyone, and good afternoon for those in Europe. First, I appreciate the invitation to join in this session. I'll give some basic and general information regarding indigenous health situation and indigenous health policy in Brazil to contextualize some comments regarding the COVID pandemic. First of all, I think it's important to say that all over the world, indigenous people, they are marginalized, face marginalization, exclusion, and discrimination all over the world. There is also an important invisibility of socio-demographic and epidemiological data for indigenous people. Not all governments make efforts to produce those kind of information. But there is strong evidence all over the world that indigenous people face poor health conditions, worse social outcomes, and they face factors such as worse life expectancy at birth, greater infant mortality, maternal mortality, low birth weight, child malnutrition, child and adult obesity, and also worse than educational and economic status. In Brazil, we have around 900,000 people, indigenous people. They represent 0.4% of the national population, but it's one of the most diverse social groups in Brazil. There are around 300 different ethnic groups in Brazil, and approximately 270 different indigenous languages. But research also has evidence of consistently unfavorable social, demographic, and epidemiological indicators for indigenous peoples in Brazil, with higher prevalence of different diseases such as malnutrition and anemia in children, infectious diseases such as malaria, tuberculosis, hepatitis B, in addition to the increasingly frequent occurrence of hypertension, diabetes, and obesity in adults. Particularly the mortality of children and adolescents of indigenous are higher for non-indigenous, and we have this kind of evidence emerging every day. So Brazil, until 1999, there was not a very structured health system response to indigenous populations. It's only in 1999 it was created an indigenous health subsystem within our national health system. It was the result of a very intense mobilization of indigenous leaders with anthropologists, health professionals, and government. Actually, Doctors Without Frontiers was in Brazil, in Roraima. And this indigenous health system attend the indigenous population in indigenous territories and is structured in 34 local healthcare units. They are called indigenous special health districts. Each district is responsible for delivering primary care with multidisciplinary health teams that involve indigenous community health workers, but also doctors, nurses, dentists, and other professionals. This system has a notion of a differentiated healthcare that recommends that health initiatives should consider the linguistic, the sociocultural, and geographic specificity of indigenous territories. So this subsystem was the front line for the response for COVID-19 in indigenous territory. So this is a little bit of the panorama of health, indigenous health in Brazil and the health policy.
Thank you, Dr. Ana. I would pass for Antonio to start to speak a little bit about the theme of the roundtable.
Okay, so thank you, Romulo. Good morning and good afternoon, everyone. Thanks for the invitation and for the opportunity to speak on behalf of Médecins Sans Frontières, Doctors Without Borders. So basically, we had a role in responding to COVID in Brazil, and this is what I want to tell you a bit about. So basically, the epidemic in Brazil started in the southeast region in São Paulo and Rio de Janeiro, and that's where we saw the cases spike. And MSF came to this region, to the southeast region, to respond. And as we were responding, we heard the bad news about the situation in the Amazon, in the northern part of the country. So we went there to respond, and when we arrived, the situation was critical. Basically, grave diggers were working beyond capacity, which means that hospitals were full, were actually beyond capacity. We had a long list of patients waiting for intensive care, and this told us back then that the situation had begun to deteriorate much earlier than when we arrived. So basically, we know that we arrived late. And why is that? Because we know that the northern part of the country, where we have the Amazon, we have the forest, we have a number of indigenous communities, they are largely neglected. And also the geographical layout of the Amazon is not conducive to a fast response. So basically, we arrived in Manaus, the capital city of the Amazonas state, where the situation was quite critical. Then, because we were monitoring the situation across the state, we noticed that some of the communities, of the indigenous communities, were getting severely affected by COVID. And you can imagine that Manaus is a city within the forest. It has a weak health system, and it's basically the only health system that is in place in the state. So we went to towns like Tefé and São Gabriel da Cachoeira, which are about 500 to 1,000 kilometers away from Manaus. And then if you need to transfer patients from those cities, they need to go by boat or by plane. So essentially, we deployed a team there because we wanted to try and identify cases earlier. We wanted to be able to monitor cases. We wanted to train teams to identify cases, and we want to train teams on infection prevention and control. So basically, when we go to these communities, when we went to these communities, we don't have a strong health system, so we need to work with the communities. And basically, when we respond to such epidemics, and this is a global pandemic, you need to work with the communities for an effective response. And MSF's history with indigenous communities dates back to the early 1990s, as Ana Lucia pointed out, because back then we responded to cholera and malaria in the Amazon region. And back then we were already working with communities. Basically, we engaged communities, or the other way around, the communities engaged us because they opened their doors, they showed us where the problems were, and then we responded to the epidemics back then. And for malaria, MSF trained the indigenous communities on microscopy for malaria, on diagnostics. And basically, we built capacity that is still there after 30 years. So basically, the key message to responding to an epidemic and to an outbreak is to work with the communities, is to build capacity. And we need to understand that communities are at the heart of success. So if we don't work with communities, and especially indigenous communities that are so underserved in Brazil, our chances of succeeding are dismal, are really small. So basically, this is what we've been doing. Basically, when we started responding to indigenous health issues back in the 90s, we engaged communities, and then when we went back to the Amazon region this year, we had to do the same, because we need culturally appropriate messages. We need to understand what their needs are. We need to understand what they understand about the disease, for example, and what their priorities are. So, for example, in Manaus, we responded to COVID by setting up an isolation center for displaced indigenous peoples. And basically, our isolation center had hammocks for people to sleep in. And that was a request from them, from the communities, because they understood that this was part of their community, and this was part of getting them to trust our response. So I think we need to put communities front and center of the response, because they know what their priorities are. And we need to educate the community with through community leaders on what this pandemic is, so that they can also protect themselves and protect their communities. So for us, the response hinges on community engagement and training people to respond within their communities.
Dr. Antônio, I will change for Portuguese to make Cretan understood. Oi, Cretan. A gente já fez a sua apresentação no início. Você tem agora de 10 a 15 minutos para falar sobre o contexto aí do movimento indígena no Brasil e também sobre a questão da Covid, como isso afetou os povos indígenas e a ação ou falta de ação do governo nesse tema. Cretan, você nos ouve?
Estão me ouvindo bem? Então, primeiro, cumprimentar a todos, né, em nome da Articulação dos Povos Indígenas do Brasil, a PIB, e dizer que estamos honrados aí com o convite para poder falar desse tema tão importante que não afeta só nós, os povos indígenas, mas afeta o mundo todo, né? Quando nós, os povos indígenas no Brasil, somos atingidos de alguma maneira, seja pelo lado como é o Covid hoje, mas também pelo lado das grandes corporações mundiais, né, que compram produtos brasileiros, não atinge só nós, né? Não atinge só nossos territórios, mas influencia no clima do mundo, influencia no aquecimento global e com isso influencia todo o planeta. O Covid para nós no Brasil hoje, para povos indígenas, é um momento muito difícil pela parte da ausência do governo brasileiro em não ter uma política de enfrentamento do Covid. E mesmo nós, os povos indígenas no Brasil, desde o ano passado e no começo deste ano, tentando conversar, sentar numa mesa de diálogo, então, com o governo brasileiro, orientando de que nós, os indígenas no Brasil, seríamos os mais vulneráveis no caso da pandemia, e ficou comprovado, porque o governo não se mexeu até agora, mesmo com um projeto de lei que tramitou no Congresso Nacional, na Câmara dos Deputados e também depois no Senado, e aprovado, e foi para ele, o presidente da República, poder assinar, né, um projeto de lei que fosse favorável aí ao enfrentamento ao Covid-19 sobre os territórios indígenas. Ele acabou vetando, né? Então, foi necessário que a PIB entrasse com um processo, com um pedido também no Superior Tribunal Federal, aonde que tivemos o êxito aí por parte do ministro Barroso do Supremo, do qual ele tornou-se obrigatório, através do Supremo, o governo apresentar um plano aí de enfrentamento ao Covid a povos indígenas. Mas até agora ainda, mesmo já passado alguns meses, até agora ainda o governo não apresentou nada. O governo tem mostrado alguns dados de apoio, de enfrentamento, mas não é isso, porque a gente sabe que não é da maneira que o governo tem feito. É um governo muito ausente, é um governo que tem declarado contra nós, povos indígenas, em todo o Brasil, desde então da sua campanha à presidência e depois sendo eleito, declarando uma guerra contra nós, povos indígenas, nos tratando como seus inimigos, e tem avançado muito o retrocesso das políticas que foram construídas no decorrer de todo esse momento que o Brasil entrou como um país democrático, de direito, e isso retrocede muito nesse governo. Em outros governos também retrocedeu, mas retrocede muito mais neste governo. E fragiliza nós, os povos indígenas, fragiliza nossos territórios, quando enfraquece os órgãos ambientais, que é o caso do IBAMA, ICMBio, e também o caso da FUNAI, que é a Fundação Nacional do Índio, que é o órgão indigenista, quando enfraquece, quando cria as próprias leis, né, quando cria normativas novas, mas nenhuma normativa é para fortalecer aí, seja por parte da proteção dos nossos territórios, ou seja, para enfrentamento, como é o caso da pandemia, né? E isso não causa um dano somente para nós, é isso que tem que ficar bem claro para o restante do planeta, que quando ataca os povos indígenas, automaticamente está atacando o planeta. E Bolsonaro, hoje, o governo brasileiro não é um inimigo específico nosso como povos indígenas. Hoje ele já se tornou um governo problemático para o mundo, né? Um inimigo do planeta, porque ataca ambientalistas no Brasil, ataca organizações ambientalistas, organizações indigenistas, organizações indígenas, povos indígenas, comunidades tradicionais, quilombolas, extrativistas e todos aqueles que lutam em defesa do meio ambiente e do clima do planeta. Então, o mundo precisa se atentar que a declaração do Estado brasileiro nesse momento por parte do governo Bolsonaro é uma declaração de guerra ao planeta. E para nós, como povos indígenas, que o Covid chegou para nós desde o mês de abril, né? Em abril começou principalmente aí pelos frigoríficos da JBS, no sul do Brasil, depois entrou através dos garimpeiros, né, no bioma amazônico, e através das pessoas que desmatam a floresta, entrou a partir das queimadas, porque as queimadas no Brasil, elas são criminosas, elas são orientadas, foi criado o Dia do Fogo no Brasil por esse governo, estabelecido por esse governo, e as pessoas, os seus seguidores, têm levado muito a sério. Começou as queimadas aí pelo bioma amazônico, o ano passado, Cerrado, foram os dois biomas mais atingidos no ano passado, do qual a gente denunciou essas queimadas criminosas, e este ano se avançou para outros biomas, como é o caso do Pantanal, onde estão povos indígenas. Então, hoje, os biomas brasileiros, o bioma Mata Atlântica, o bioma Cerrado, Amazônico, Pantanal, Caatinga, todos esses biomas, se não estão em chamas, por exemplo, que é o caso da Mata Atlântica e o caso da Caatinga, mas estão com reduções de direitos ambientais, leis ambientais, para o avanço aí do agronegócio sobre esses biomas. E também para os grandes empreendimentos, né, que vão acontecer nesses biomas também, como é o caso da Mata Atlântica, e que vão atingir territórios indígenas, né, nesse bioma, no caso de construção de portos, né, porque o bioma Mata Atlântica ele fica na região litorânea do Brasil, a construção de porto, de ferrovia, rodovia, tudo para poder escoar a soja e a carne que sai da região amazônica e que vai passar pelo bioma Mata Atlântica. Então, é necessário que o mundo entenda que o Brasil, hoje, a Amazônia significa, para nós, povos indígenas de outros biomas, como para defender esse bioma, porque esse bioma não é de importância somente dos povos indígenas que estão em região amazônica, mas é de interesse dos povos indígenas do Brasil e é de interesse do mundo. Então, é necessário que nós nos una forças para que a gente possa fazer essa defesa, porque se hoje o Covid-19 avançou e agora o retorno da malária também muito forte, porque a queimada faz com que o mosquito aumente, o mosquito transmissor da malária, e nós vamos ter outras pandemias. A pandemia, para nós, uma pandemia, ela não é momentânea, uma vacina cura, por exemplo, que é o mundo que é uma vacina. A nossa, depois dessa pandemia, virão outras pandemias, virá malária, virá outras doenças, e as doenças mais graves, que são as doenças espirituais para vários povos, por perder suas florestas, né, perder os seus rios contaminados, perder os animais, né, perder a fauna, a flora, nesses territórios aí que foram atingidos pelo fogo, pelo garimpo, incentivado aí por esse governo. Hoje no Brasil, né, chegamos aí, a nossa população é uma população pequena, dos povos indígenas, somos próximos de 900 mil indígenas, então cada indígena que morre para nós é muito ruim para nós povos indígenas, porque não, além da a nossa população ela ser pequena, ela também é uma população que muitos dos nossos mais velhos, as nossas bibliotecas, as nossas memórias, da nossa cultura, da nossa espiritualidade, são os mais atingidos, né, com o Covid-19. Hoje chegamos próximo aí de quase 900 mil mortos indígenas no Brasil, 900 mortos, quer dizer, desculpe, 900 mortos, em torno de 38 mil contaminados hoje por Covid em todo o território brasileiro, né? E em 24 estados brasileiros, né, onde tem presença indígena também já contaminado, e mais de 158 povos indígenas já contaminados aí pelo Covid, dos 305 povos que hoje a gente tem no Brasil. O principal bioma brasileiro que tem o maior avanço, né, do Covid foi o bioma amazônico, em seguida aí o Cerrado, porque está pelo menos em 3 regiões do Brasil, o Cerrado, né? O segundo foi o Pantanal, e o terceiro a Mata Atlântica, e em quarto a Caatinga, que são os biomas aí que foram atingidos aí pelo Covid. Então, é necessário que nós tenha essa unidade, e como eu já falei, se ataca e declara guerra contra os povos indígenas no Brasil, comunidades tradicionais, ambientalistas, organizações ambientais, organizações indigenistas e indígenas, ataca o mundo, porque é nós que temos esse papel de defender as nossas florestas, né, manter ela em pé para o bem do planeta. Hoje não é mais só responsabilidade do Brasil. Hoje a responsabilidade requer ao mundo, que é enfrentar esse governo, como nós, os indígenas, temos procurado enfrentar, inclusive com as nossas próprias vidas, nem que nos custe a vida ou custe até a criminalização que nós também, lideranças, vemos sofrendo aí por parte desse governo, sofrendo ameaças aí por parte do governo, ameaças declaradas, como é o caso aí dos seus ministros, como foi o caso do general Heleno, que ameaçou a Sônia Guajajara, ameaçou aí a PIB, né? E as perseguições que a gente sofre durante a COP do ano passado, onde que foi uma delegação aí orientada por esse governo para investigar o que os indígenas e toda a sociedade civil que tinham ido para a COP foram lá para falar ou denunciar. E todas as falas dele na ONU ou em qualquer instância que o governo brasileiro tem falado são mentiras. Nenhuma é verdade, porque ele ignora a ciência, ignora as academias, né, que orientam sobre a situação do Covid, ou seja, pela questão do clima. Então, a princípio, seria isso a minha fala, e fico agradecido aí, esperando aí pelas perguntas que me for solicitadas.
Obrigado, Cretan. Thank you, Cretan. I would pass the speak for Dr. Ana to talk a little bit about the answer of the authorities in Brazil on COVID and the relation between fire and health in the Amazon, the different biomes.
I want to reinforce some points that all the colleagues have pointed out. First, it has been a very complicated political situation and context in Brazil, aggravated since the last years, because this government has a very clear position against indigenous rights, but also against the public health system. So we haven't had budget cuts, and we have much militarization right now of positions in the Ministry of Health and also Indigenous Health Service. So we have seen since last year a very complicated situation when the Minister of Health was really questioning the maintenance of this indigenous health subsystem. So when the pandemic began and arrived in Brazil, we were very much worried about the response, because we knew the health inequalities of indigenous people in Brazil. We knew that they would have a lot of problems to maintain the social isolation due to the necessity to go to the cities to buy food, to sell products, to get money, and to continue their life. We knew that there were several attacks to indigenous territories, and it's very well clear what Cretan was talking about. Historically, this unwanted contact of non-indigenous society with indigenous people have led to epidemics. And it's one of the main causes for depopulation of indigenous people in Latin America and in Brazil. It's still today other respiratory, for instance, other respiratory epidemics have had a clear, very rapid spread, and leading to hospitalization mostly of children and older people. And we saw this in the H1N1 epidemic. We have seen in other measles this epidemic. So it was a very strong memory that was resumed by the indigenous people, that they have seen this scenario of epidemics that were very devastating, and that this impact very much on social organization, and impact, as Cretan said, also in memory, knowledges, and political struggle. And we knew that the indigenous health subsystem was under attack. Last year, we had the financial budget was fixed, and also the contraction of health professional. We didn't have much a very secure situation that the maintenance of this health system would be perfect for this year. Already last year we had this uncertainty. So we expected that the government would have a very difficult dialogue with indigenous people and partners. And what we have seen actually was this. There was a very, not a very good disposition for conversation among the managers and technicians and indigenous health secretariat and indigenous people and academics or other organizations that were working indigenous people. We have seen that the budget was very less used. It was like 1/3 of the resource that were available for the pandemic response were used. So we saw an financial execution very low, mostly in March, April, in May, and just began to raise in June. And as Cretan told, we didn't have a national plan, neither for the Brazilian general response and much less for indigenous people. There was only very general orientation that did not specify very important questions, such as where and how would be the access for molecular diagnosis to COVID. Where and how is the flux to get the access to hospitalization, and how would be the plan to provide equipment for this health team that were working in the indigenous land. And as Antonio told, the key aspect to response in indigenous territory is the dialogue and the coordination with indigenous people. We haven't seen much of this in Brazil. And the other factor that Romulo Cretan was putting, we were very worried already about the situation of invasion in indigenous land. We saw last year an increase in deforestation and in fire. And we had in the beginning of this year also a study that was very clear, pointing out the increase of hospitalization for respiratory disease due to fire exposed. So it reaches out to 25% of more hospitalization in periods where you have increasing fires. So we knew about the relationship between fires and respiratory problems, but also we all knew that the fire which are provoked by illegal invasions in territories, we also knew that those persons, they spread disease as malaria and other infections. So we were much worried about COVID as well. And now we have seen the first studies that are really relating that deforestation is related as well, increase of COVID cases in several regions. So there is a correlation. This correlation is related to the vulnerability that the smoke causes to respiratory apparatus, and as well for the interest and contact of persons that are not controlled in health settings and that can introduce COVID in indigenous territory. So we are much still worried because the situation is not under control. We are worried about the second wave in Europe and how this is going to come here in Brazil, because we don't have, up to this moment, a structured plan from government to indigenous health response to COVID. As Cretan told, it's in the Supreme Court, and once again, it was asked for the government to reformulate their plan because it's not good enough, it's not detailed enough, it has some fragilities in technical aspects, and we are also face a timeline that all the extraordinary response in government, they are programmed until December, and we are already in November. So the situation is very, very, very worrying. And as Cretan told as well, it's very important to indigenous rights struggle in Brazil, the international discussion and support, because indigenous rights in Brazil, they face much conflict in very fundamental economic positions, mostly for these areas that Cretan was staring, agro business and other related.
Thank you, Dr. Ana. I will pass for Antonio.
Okay, thank you, Romulo. I just want to comment on a few things that were said regarding access to care, to healthcare. So indeed, when you go to indigenous lands or when you have a crisis in indigenous lands, you need access. That was our experience with COVID when we arrived in Tefé and São Gabriel da Cachoeira. They already had a huge crisis because the response was slow. So basically, we faced a system where decision making is very centralized. And then it makes the whole process rather burdensome. So I think to respond to indigenous communities' needs, we would have liked to have faster access to these communities. And just commenting on what Greta said, other crises will come, it's true, and we need an action plan, and we need quick access to these communities. That's why it's important to reinforce. I want to reinforce that the bottom-up approach is normally more effective, because when communities flag a crisis, we are ready to act. So again, that was our approach back in the 90s. That was our approach again. We don't think we need to reinvent the wheel. We need to work with the communities. We need to ensure that they have access to healthcare. And also, just to remind something that is important, when we talk about healthcare, we don't necessarily talk about westernized healthcare systems. We need to strengthen community health systems, because that's where our response can be faster and more effective. So thank you.
Thank you, Dr. Antonio. I would like just to talk a little bit about the work that Greenpeace did in the last 5 months. This is a very different year because the challenge of COVID, we not stand by and launch this project called Wings of Emergency. We transport more than 63 tons of different kind of issues, from oxygen to soap, alcohol, and a lot happening in these 5 months. our help, we made more than 28 flights and more than 3 expeditions by boat. The equipments and the people that we transport help more than 100,000 indigenous people from 70 different ethnicities from 4 states in the Amazon: Amazonas, Acre, Pará, and Maranhão. It was at least 96,000 of flew and more than 68,000 sailed. If we think the amount of hours that we work flying and deliver these things, it's represent something close to 148 hours. It's like 27 days. If we are getting in a line, it will be like 27 days just flying, no stopping. The other things, we build a small fabric of masks in our office here in Manaus, where we have more than 20 volunteers and people from the staff of Greenpeace working, and we made more than 41,000 masks on this on our office, and we bought more 20,000 from the women's Satere Maué. We donate this for hundreds of different indigenous communities that do not have the basic research. This project was in collaboration with another 11 organizations. They are represented here by Fiocruz, was a partner, Medicine Sans Frontières, take part 2, COIAB from APIB was part 2, and was, in my opinion, one of the best project we have in Greenpeace ever, because it was about humanitarian help and not only about environmental, it's help for those that are helping the forest since ever. Cretan, I will change for Portuguese to speak with Cretan. Cretan, a gente tinha uma pergunta, eu acho que você pode ajudar a responder, com as mudanças climáticas previstas, qual vai ser o impacto disso na população indígena, e como você vê essas mudanças acontecendo, o que pode acontecer, seja com a cultura, seja com o território de vocês?
Então, muitos desses impactos que vão acontecer com as mudanças climáticas são irreversíveis. Porque dentro dos nossos territórios, né, dentro das nossas terras, a gente tem uma harmonia com a natureza, né? Seja por parte das medicinas, seja por parte da espiritualidade, por parte da produção de alimentos, né, dentro dos nossos territórios. E com a mudança climática, tudo isso muda para a gente também. Porque a medicina, ela tem seus dias, seus tempos e seus horários para poder ser retirada para a produção dessa medicina. Os alimentos é o mesmo sistema, ele tem um mês, né, do ano, né, tem os dias, tem a lua, então tudo isso influencia o momento de chuva, o momento de calor, então isso vai nos afetar de uma maneira que provavelmente é irreversível, né? E a questão também dos próprios rituais, né, dos próprios que a gente pratica como povos indígenas no Brasil, os momentos, as nossas ações, que é esse momento espiritual, com a queimada, com o desmatamento, com o garimpo, com a perda do território, tudo isso influencia nessa situação do clima para nós, né? Então, nós temos uma mudança aí irreversível, e isso, como eu falei já no começo da minha fala, ela influencia nas doenças espirituais. Muitos povos têm doenças espirituais que tá muitas vezes acima do próprio Covid ou da própria malária, porque tudo com nós, povos indígenas, tem o tempo para tudo, né? Não é simplesmente eu chegar na floresta, por exemplo, até uma árvore que seja utilizada ela para um ritual, não é simplesmente chegar ou tirar ela ou derrubar ela, envolve tudo uma parte espiritual para você poder fazer. A própria medicina envolve tudo uma parte espiritual, e quando você arranca ela, quando você tira ela, quando você mata os animais, como aconteceu no Brasil, aqui com as queimadas, isso é irreversível para nós. É uma perda irreversível, porque dentro do território, dentro da nossa terra, a gente não é diferente de nada do que tem ali. Nós somos um ser dentro daquele território, como as árvores, como os peixes, como o rio. A gente faz parte ali como qualquer outro, como os animais, não somos diferentes, não tratamos aquele território como exclusivamente nosso. São dois seres, e principalmente dois seres espirituais que habitam esses locais, né, onde nossos ancestrais pisaram, onde os nossos ancestrais vivem, né, em espírito com a gente. Então, uma medicina, por exemplo, ela não é uma medicina indígena que tem todo esse tempo, e com certeza as mudanças climáticas, o clima vai influenciar. É uma medicina que não se engarrafa ela e você não consegue produzir ela em cápsula, porque ela vem envolvida com a espiritualidade. Então, quando você engarrafar e colocar numa cápsula, ela se tornará uma droga como qualquer outra medicina que hoje é existente no mundo. Então, é necessário nós, os indígenas, e o planeta viver em harmonia com a natureza para que o clima também não influencie no futuro nosso com povos indígenas, e que as nossas futuras gerações estejam num território, num planeta puro e limpo. Então, seria esse sentido que, para nós, o clima vai influenciar muito nessas mudanças aí de vida nossa.
Obrigado, Cretan. I would open space for Antonio and Ana Lucia if you want to comment something that Cretan told or bring any other information.
Go first. Yes, I would like to reinforce what Cretan is telling. Indigenous people, they are alarming us about the impacts of this kind of relationship, or this predatory or this consumist society, this impact to the health and well-being of not only them, but the whole world. And they are a very important knowledge and producer about this kind of relationship, and for, I think, key messages to find solutions to the situation that we are facing. I think we have much the responsibility, I say, for someone in the academic world, to recognize this knowledge production, to dialogue in a very symmetrical way with them, and that to find a solution, we have to establish a more equal relationship with Indigenous people in terms of respecting their self-determination and diminishing the impact we cause in their being, but also learning from them some tips about how we can live better and how we can less impact in Mother Nature, and how we are connected to that. So I think we have to listen and really to establish a new kind of relationship with Indigenous people, and they have much to offer to finding solutions to the problems we are facing due to climate change.
Okay, so very quickly on that, I know that climate change is a major issue nowadays. It has an impact on health. So as an organization, we have been monitoring the situation. And then we know that climate change will affect societies who actually produce less climate change. So societies who have a lower carbon footprint, and these societies, when they are affected, their capacity to respond, is reduced. We saw that, for example, in Mozambique last year with the cyclones. And again, when we talk about indigenous communities, communities who are underserved, who are very vulnerable, they certainly will be very much affected by this. And as an organization, we need to monitor this. We need to see the crises that are cropping up across the world to respond quickly. But it's important that we have that in mind, that these crises, they will affect heavily underserved communities.
Antonio, we have some questions come from people that are seeing us. I will make this in português to Cretan. Cretan, o pessoal está mandando perguntas, tá? Veio aqui uma, vamos ver se você pode ajudar. Eles estão perguntando com os impactos da Covid, também das queimadas, se você sabe se teve algum grupo, se teve alguma comunidade que teve que se deslocar, teve que sair do lugar, e se sim, para onde eles acabaram indo por conta disso.
Então, aconteceu mais na região amazônica, né? Não aconteceu aí, pelo que eu sei, em outros biomas, mas na região amazônica aconteceu, né? E teve que haver esse deslocamento devido à questão da aldeia entrar em chamas, né? Então, foi as denúncias aí que a gente recebeu na PIB, inclusive com vídeos, né, da perda dessa comunidade, né, devido às queimadas, e com certeza influencia no avanço do próprio Covid, porque uma orientação que a gente deu pela PIB no início da pandemia é que fosse criadas barreiras sanitárias para que o Covid não entrasse dentro das terras indígenas, né? Mas devido a algumas situações que aconteceu no Brasil, inclusive por essa remoção de comunidade que fez com que acelerou, né, a entrada aí por parte do Covid aí em terras indígenas. Daí eu não lembro o nome da terra indígena, mas se a Ana lembrar, poderia falar qual aldeia que entrou, né, o Covid e que queimou, né, a comunidade, foi preciso remover.
Está no mudo, Ana.
No, actually, I don't know the name, but there was several communities in Xingu region, in Mato Grosso region, also in Amazon, that they reported that the fire was very, very close to them, and the smoke with the wind was reaching and intoxicating people, and they were facing this dilemma because they were very much engaged in maintaining the isolation, the social isolation because of COVID, and not circulating. And this kind of situation pressured them to a very complex situation of leaving their lands, and they do not have exactly where to go and protect themselves. We don't have much a governmental apparatus to protect and respond to this kind of situation. So there was much reports in social media, and as I told, and now we do have some evidence of the direct correlation of deforestation and the increases of COVID cases after 2 weeks. So there is much evidence of this kind of situation, and the consequences are the necessity of living their communities, but also it's important to reinforce that this consequences also impact in food security, because this is menace the animals and the plantation. This will impact in this kind of relationship and spiritual relationship with land and sacred places. So there is much also social, culture, and health conditions impact to this kind of situation.
Thank you, Anna. We have another question that I will make for Antonio, that what are the plans for advocacy and pressure the government about the COVID and indigenous people, and how is the doctor out and Medicine Sans Frontières work on that, and what do you think that civil society can help?
Okay, thank you, Romulo. So basically, we understand that indigenous communities are particularly vulnerable to COVID. We've seen that. That's why we've responded in indigenous communities as well as urban settings. So for us, it's one of our priorities. So we've responded in São Gabriel da Cachoeira, where the population is basically 90% indigenous. We went to Mato Grosso do Sul as well to respond to COVID in 11 indigenous communities. So for us, it's clear that these communities are a priority in terms of COVID. And of course, as we speak, we are monitoring the situation across the country. You can imagine that a country as big as Brazil is quite hard to monitor, but we are making some effort to keep monitoring with an eye on the indigenous situation. Well, how the civil society can help, as I said, I think this whole process of responding to epidemics needs a bottom-up approach. So communities need to identify the gaps, need to identify their priorities, and they need to voice their concerns. It's true that we need to find channels for that, but again, back in the 90s, we worked with communities. That was the foundation of one of the foundations of the indigenous health system in Brazil. And for us, it's still the same idea. We need a bottom-up approach. We need civil society to identify gaps and be vocal about this. Thank you.
Comments regarding social society participation. I think it's very important to reinforce that first it was very strategic. It was very much imposed by indigenous organization, as Antonio was telling, and they were very rapid in this mobilizing and working campaigns with media to ask for help for food security first, for masks, and also for it's very important to say that as also for resource for health services. So indigenous and civil society had a very important part in rapidly sponsoring for giving the necessary support for health services as well, because they didn't have much equipment for protections of the health professionals, and there were problems for also providing structure. The indigenous health system, they do not have a much structured health structure in indigenous land. They didn't have like you say, a health service as we know in cities. So it was needed support for oxygen equipment and monitoring clinical situations that they didn't have this kind of apparatus. So civil society had a huge part in helping the government structure this kind of health units in indigenous lands and supporting health professionals with the tests for diagnosis, for equipments for their own protections. So we have seen that it was very potent. This kind of articulation is still going on, and it was much mobilized by indigenous organization. We had some problems. Even though we had some problems to implement this kind of initiative, because it's necessary to be clear that to provide and to assist with healthcare indigenous community, it's made by government authorization. So it was much a negotiation in progress to make this possible. And sometimes it takes longer than we wanted, but it was very, I would say we have much experience of success in some regions. In some regions, we had to do some pressures to make it possible, but this was a very important part of the response to COVID indigenous conflict.
Okay, thank you, Dr. Ana. We are coming to the end of this session. I will leave space for you guys for a final message. I will start with Cretan. Cretan, a gente está chegando aqui no fim dessa conversa. Queria que você deixasse uma mensagem final aí sobre a luta aí dos povos indígenas aqui no Brasil, para o público que está nos assistindo.
Então, primeiro agradecer, né, em nome da PIB, aí ao convite, né, para essa conversa, para que a gente possa, o público que está nos assistindo, entender um pouco do que está acontecendo no Brasil, porque a questão é muito maior do que se imagina, né, do que as pessoas que estão assistindo estão imaginando. E agradecer, né, a cada um de vocês também, o Rômulo, a doutora Ana, o Antônio Flores, e dizer que desde que a gente entende esse mundo como mundo, que a gente vem orientando esse planeta, que precisamos preservar, precisamos ter as nossas terras indígenas garantidas, demarcadas no Brasil, precisamos ter políticas de enfrentamento, por exemplo, essa questão do Covid, mas também de enfrentamento aí sobre a questão da proteção dos territórios indígenas em todo o território brasileiro, as nossas florestas em pé, e para as florestas em pé continuarem em pé, há uma necessidade da proteção dos indígenas, né, do respeito por parte do Estado brasileiro, por parte dos governos. E quando ataca nós, indígenas, quando ataca as nossas florestas, automaticamente ataca o mundo. Então, hoje, a gente sente que o mundo está preocupado com o que está acontecendo no Brasil com as queimadas e com o avanço da soja, com o avanço aí das grandes fazendas produtoras de gado sobre o território amazônico. Mas também é necessário que o mundo comece a entender que nós precisamos fazer uma mudança, não é só assinar acordos internacionais, como é a questão do Acordo de Paris, sobre a questão do clima, não é só isso assinar, é a gente começar a pensar diferente através das suas políticas de consumo em seus países, das suas políticas de investimento no Brasil, porque todo o investimento que são feitos através dessas grandes empresas são elas aí que afeta nossos territórios e afeta as nossas vidas, e com certeza a natureza vai dar essa resposta ao planeta, que é o aquecimento global e que é as mudanças climáticas que está acontecendo hoje em todo o mundo. Então, essa é a minha mensagem que eu deixo aí para quem estiver nos assistindo e quem estiver acompanhando. Desde já agradeço mais uma vez em nome da Articulação dos Povos Indígenas do Brasil.
Obrigado, Cretan. Antônio?
Okay, so first of all, thank you for this very productive conversation. It's really interesting, and I just like to end by quoting activists: "Nothing for us without us." So basically, if we need to work with communities, we need to listen to them. As a non-Indigenous healthcare worker, I cannot tell them what they need. I need to listen to them and then build a response with them. That's what we are doing. We've been doing. That's what we did in the past. We are still doing, and we are committed to continue to do. So we need to work with communities for effective responses.
Yes, I appreciate the invitation, and also thank you for the partnership of Doctors Without Borders and Greenpeace in this process. And reinforce that social justice, solidarity, they are very important values to defend, and indigenous rights are a big part of this. And so I think it's a struggle that we all should care for and are engaged, because it's not possible to have a better world or face the problems we're facing without caring for the people that are vulnerable, but they are not only vulnerable in terms of victims, they are much more part of the solution. As Antonio said, we have to engage with them in this kind of solutions. Thank you very much.
Okay, thank you all for the participation. I would like to thank the organization of the Congress too, in name of Greenpeace Brazil. It was an honor to have this conversation with you.